Millions of older adults are being overtreated for a blood pressure number that, after 65, may actually be completely normal. Your doctor looks at that reading, frowns, and reaches for the prescription pad. But here is what they are not telling you. The guidelines used to define high blood pressure were largely developed on younger adults, and applying those same numbers to a 65, 70, or 80-year-old body is not just misleading. In some cases, it is genuinely dangerous. Stay with me because the number one truth I am going to reveal today has been buried under decades of pharmaceutical marketing. One landmark study found that aggressive blood pressure lowering in adults over 70 actually increased the risk of falls, kidney damage, and cognitive decline by a shocking margin. And yet, millions of seniors are still being pushed toward medications based on a number that was never designed for their age group. If that does not make you want to keep watching, I do not know what will. I am Dr. Eleanor Whitfield, a physician specialized in senior health with over 15 years of dedicated clinical experience. I have sat across from thousands of men and women, over 60 who walked into my office terrified, convinced they were one heartbeat away from a stroke, all because of a number on a screen. What I am about to share goes against what most mainstream medicine will tell you, but I have seen it with my own eyes, patient after patient, and I can no longer stay silent. Here is what is actually happening inside your body after 65. As you age, your arteries naturally become less flexible. They stiffen slightly, and this is a normal biological process. Because of that stiffening, your heart has to pump a little harder to push blood through. This causes systolic pressure, that top number, to rise. It does not necessarily mean your heart is failing. It does not necessarily mean you are about to have a stroke. In many cases, it simply means you are aging. A study published in the Journal of the American Medical Association found that up to 40% of seniors currently classified as hypertensive, based on standard guidelines, would be reclassified as normal or only mildly elevated when age-adjusted criteria are applied. 40%. That is not a rounding error. That is a massive portion of the senior population being unnecessarily alarmed and, in many cases, unnecessarily medicated. And here is what terrifies me most. The medications used to aggressively lower blood pressure in older adults carry real serious risks. Dizziness, lightheadedness, sudden drops in pressure when standing up, a condition called orthostatic hypotension. That drop is one of the leading causes of falls in adults over 65. And falls, as you may know, are the number one cause of injury-related death in seniors in the United States. So the very treatment meant to protect your heart could be the thing that puts you on the floor. Before we go any further, I want to ask you something. How do you feel when you see your blood pressure reading at the doctor's office? Does your stomach drop? Do you feel your heart start to race? If so, type pressure in the comments below. Because that reaction itself, what researchers call white coat hypertension, can temporarily spike your reading by 20 to 30 points. You could be walking around with perfectly healthy blood pressure and showing elevated numbers every single time you step into a clinic. And if you are finding this information valuable, please hit that like button right now, because this is exactly the kind of conversation that most medical offices simply do not have time for. Now, what I want to do today is walk you through the 7 most misunderstood blood pressure truths for adults over 65. We are going to go from the least critical to the most important. And by the time we reach number 1, you are going to have a completely different relationship with that cuff on your arm. Let us begin. Truth number 7. The bottom number matters less than you think after 65. Most people over 60 have heard their doctor talk about both numbers. The top one, systolic, and the bottom one, diastolic. For decades, medical training emphasized the diastolic reading as a key marker of cardiovascular risk. But here's what the research has quietly confirmed over the past 20 years. In adults over 65, isolated systolic hypertension, meaning a high top number with a normal or even low bottom number, is far more common and far less dangerous than previously believed. A study published in Frontiers in Aging found that in adults over 70, a diastolic reading below 70 millimeters of mercury was actually associated with increased cardiovascular risk, not decreased. This is called the J-curve phenomenon. When doctors push the bottom number too low in older patients through medication, they may actually be reducing blood flow to the heart during its resting phase. The result can be increased risk of heart attack, not protection from one. The key takeaway here is this. If your bottom number is in the 70s or low 80s, and your top number is mildly elevated, that is often a completely acceptable profile for someone over 65. Do not let anyone tell you that you need to aggressively drive both numbers down without a full conversation about your age, your kidney function, and your fall risk. Truth number 6. Your blood pressure naturally rises throughout the day, and that is normal. Here is something almost no one explains to their patients. Blood pressure is not a fixed number. It fluctuates constantly, sometimes by 30 to 40 points, across the course of a single day. It is lowest in the early morning hours, typically between 3 and 6 a.m. It rises sharply in the hour after you wake up. It peaks in the late morning and early afternoon, then it drops again in the evening. This is called the circadian rhythm of blood pressure, and it is hardwired into your biology. Now here's the problem. Many seniors get their blood pressure checked in the mid-morning, right at the daily peak. They are already a little anxious from the drive, maybe they had a cup of coffee, maybe they rushed to make the appointment on time, and then they are told their reading is dangerously high. But that reading may reflect nothing more than normal daily variation, compounded by situational stress. Research published in the Journal of Clinical Nutrition found that ambulatory blood pressure monitoring, meaning measurements taken throughout the entire day, gave a far more accurate picture of cardiovascular risk than single clinic readings. In fact, single readings were shown to misclassify up to 30% of patients. If your doctor is making major medication decisions based on a single reading taken once every 3 to 6 months, that is a problem worth discussing. Truth number 5. Salt is not the villain it was made out to be, especially after 65. For 40 years, seniors have been told to cut salt or face the consequences. Low-sodium diets have been prescribed so aggressively that many older adults are genuinely afraid to season their food. But the science on this is far more nuanced than the headlines suggest. Yes, some people are what researchers call salt-sensitive. In these individuals, sodium intake does meaningfully raise blood pressure. But a comprehensive meta-analysis published in the New England Journal of Medicine found that adults over 65 who followed very low sodium diets, under 1,500 milligrams per day, actually had higher rates of cardiovascular events than those who consumed moderate sodium. The reason is complex but important. At very low sodium levels, the body activates a hormonal stress response involving the renin-angiotensin system. This cascade can raise blood pressure, increase heart rate, and promote arterial stiffening. In older adults whose kidneys are already less efficient at managing fluid and electrolyte balance, extreme sodium restriction can be genuinely destabilizing. The current evidence suggests that most seniors without specific conditions like heart failure or advanced kidney disease do just fine with a moderate sodium intake of around 2,000 to 2,300 milligrams per day. That is the equivalent of about a teaspoon of salt. Enough to enjoy your food, enough to keep your hormonal systems from panicking, and nothing like the bland, flavor-stripped diet that has been pushed on seniors for decades. If you are finding this helpful, please subscribe to this channel and share this video with someone you care about. My mission is simple. Provide clear, honest health information for adults over 60 who deserve real answers, not fear. A single share could start a conversation that genuinely changes someone's life. Truth number 4. White coat syndrome is dramatically underdiagnosed in seniors, and it is inflating treatment rates across the country. Let me tell you about Patricia. She was a 71-year-old retired school teacher from Atlanta. 43 years in the classroom, tough as nails, and completely terrified of the doctor's office. She had lost her husband to a heart attack 8 years earlier, and every time she sat in that exam chair and felt the cuff tighten on her arm, her mind went to the worst place imaginable. Her readings in the office were consistently in the 155 to 165 range on the top number. Her cardiologist had her on 2 medications and was considering adding a third. When she came to see me, I asked her one question. Have you ever checked your pressure at home? She had not. I gave her a simple home monitor and asked her to take 3 readings every morning, before coffee, before stress, before the day really started, and send me the log at the end of 2 weeks. Her home average was 128 over 74. She had been on two blood pressure medications for 6 years for a problem she did not actually have outside of a clinical setting. When we carefully and gradually reduced her medication under close supervision, she told me something that broke my heart and made me furious at the same time. She said, "Doctor, I have not felt dizzy when I stand up in years. I forgot what it felt like to just stand up and not grab onto something." That dizziness she had accepted as a normal part of aging was orthostatic hypotension caused by overmedication, and it was a fall waiting to happen. This was not a miracle. This was simply taking the time to get an accurate picture. And you deserve that same accuracy. A study published in the Journal of Applied Physiology estimated that white coat hypertension affects between 20 and 30% of adults diagnosed with high blood pressure. In seniors, the rate may be even higher due to increased health anxiety, prior medical trauma, and the natural stress response that activates in clinical settings. If your readings at home are consistently 10 to 15 points lower than at the office, please bring those numbers to your doctor and ask for a formal conversation about whether your diagnosis was based on accurate data. Before we move to the top 3 truths, I want to hear from you. Have you ever been told your blood pressure was dangerously high, only to check it later at home and find it was completely different? Share your experience in the comments. I read every single one, and your story might help someone else realize they are not alone. Truth number 3. Dehydration is one of the most overlooked causes of erratic blood pressure readings in seniors, and almost nobody talks about it. Here is a mechanism most people have never heard explained. When you are even mildly dehydrated, your blood volume decreases. Less fluid in the blood vessels means the vessels have to constrict slightly to maintain pressure. This can cause a temporary rise in blood pressure. But here's the cruel paradox. When you then stand up quickly from that dehydrated, constricted state, the vessels may not adjust fast enough and your pressure drops sharply. This is another major driver of orthostatic hypotension in seniors. Now, why are seniors particularly vulnerable? Several reasons. First, the thirst mechanism becomes less reliable with age. Research published in Nutrients Journal found that adults over 65 frequently fail to feel thirsty even when clinically dehydrated. Second, many seniors are on diuretics, medications specifically designed to make them urinate more, which compounds fluid loss. Third, the kidneys become less efficient at conserving water with age, meaning more fluid is lost even during normal daily activity. A study from the Journal of the American Medical Association found that mild to moderate dehydration, defined as a fluid deficit of just 1 to 2% of body weight, was associated with systolic blood pressure elevations of 8 to 12 points in adults over 65. That is not a trivial amount. That could be the difference between a normal reading and a reading that triggers a prescription. The practical application here is straightforward. If you are going in for a blood pressure check, make sure you are well hydrated the day before and the morning of. Drink water consistently throughout the day, not just when you feel thirsty. Aim for at least 6 to 8 glasses daily unless your doctor has specifically restricted fluid intake for another medical reason. And if you are on a diuretic, discuss with your physician whether the timing and dosage still makes sense given your current blood pressure readings. Truth number 2, the 120 over 80 target was never meant for adults over 70, and pursuing it aggressively can cause serious harm. This is where things get important. The famous 120 over 80 target has been burned into the public consciousness as the gold standard for healthy blood pressure. It is printed on posters in clinic waiting rooms. It is cited in every patient brochure. And it is completely wrong as a universal standard for adults in their 70s and 80s. I remember James, a 78-year-old retired engineer from Chicago. He was sharp, active, and determined to do everything right. When his cardiologist told him his target pressure should be 120 over 80, he took that target seriously. He changed his diet dramatically. He reduced his sodium aggressively. He took his 3 medications exactly on schedule, twice a day, every day. His readings at the office got closer and closer to that target. And then one morning, he stood up from his recliner to answer the phone and collapsed. He fractured his hip in the fall. The surgery to repair it went well, but the recovery at 78 was brutal. He was in rehabilitation for 3 months. He lost 18 pounds of muscle. He never fully regained his previous level of independence. When we reviewed his readings from the week before the fall, his pressure while standing had dropped to 88 over 52. His body simply could not maintain adequate blood flow to his brain when he shifted to an upright position. His vessels, stiffened by age and stressed by overmedication, had no reserve left. James looked at me during a follow-up visit and said something I will never forget. "Doctor, I was so focused on hitting that number that I forgot to pay attention to how I actually felt." A landmark clinical trial called SPRINT, published in the New England Journal of Medicine, found that intensive blood pressure, lowering below 120 systolic, in older adults reduced cardiovascular events but also significantly increased adverse events, including acute kidney injury, falls, and fainting episodes. The researchers themselves concluded that the benefits had to be weighed carefully against the risks for each individual patient, particularly those over 75. Current guidelines from several major cardiology organizations now acknowledge that for adults over 75 with frailty, a systolic target of 130 to 140 may be more appropriate than 120. Some guidelines go further and suggest that 140 to 150 may be perfectly acceptable for the oldest and most frail patients. The point is not that blood pressure does not matter. It absolutely does. The point is that chasing a number designed for a 45-year-old body inside a 78-year-old body can cause more harm than the elevated reading itself. If you believe this information deserves to be heard by more people over 60, type yes in the comments right now. If you are skeptical and want to hear more before you decide, type 0. Either way, your response helps other viewers know they are not alone in questioning what they have been told. And now we arrive at truth number 1. The single most important thing to understand about blood pressure after 65. The one that almost nobody in mainstream medicine will sit down and explain to you. Truth number 1. The real danger is not your blood pressure number. It is the variability of your blood pressure, and fixing that changes everything. Here is what the latest research is revealing, and what I believe will completely reshape how we approach senior cardiovascular health over the next decade. It is not your average blood pressure reading that best predicts your stroke and heart attack risk after 65. It is the variability. How much does your pressure swing up and down across the day, across the week, across the month? A groundbreaking study published in the New England Journal of Medicine followed over 11,000 adults with an average age of 71 for 7 years. The researchers found that visit-to-visit blood pressure variability was a stronger predictor of cardiovascular events and cognitive decline than the average blood pressure level itself. In other words, a person with consistent readings of 138 over 82 may face lower cardiovascular risk than a person whose readings swing between 115 and 165, depending on the day. Why does variability matter so much? Because every time your blood pressure spikes and drops, it creates mechanical stress on the walls of your blood vessels. Imagine a garden hose that is constantly being squeezed and released, squeezed and released. Over years and decades, that repeated mechanical trauma damages the endothelium, the delicate inner lining of your arteries. It creates micro tears that become sites for plaque accumulation. It stiffens the vessel walls further. It reduces the brain's ability to regulate its own blood supply, a process called cerebrovascular autoregulation. And impaired autoregulation is now understood to be a major driver of vascular dementia. So, what causes blood pressure variability in seniors? Several factors. Poor sleep quality causes major overnight and morning pressure spikes. Chronic low-grade dehydration, as we discussed. Irregular meal timing, emotional stress and anxiety. Sudden temperature changes. Inconsistent medication timing, taking blood pressure pills at wildly different hours each day. And paradoxically, over-aggressive treatment that forces the pressure too low can trigger compensatory spikes. I want to share one more story with you. Her name was Dorothy, a 74-year-old retired librarian from Boston. She came to my office frustrated and confused. Her blood pressure log looked like a roller coaster. Some days 148 over 88, other days 112 over 68. Her doctor had increased her medication twice in 3 months, trying to bring the high numbers down. But the low numbers were getting lower, and she was spending entire afternoons lying on the couch because she simply had no energy to move. We did not add a medication. We built a protocol around stability. Consistent wake time every morning, 16 ounces of water before her feet hit the floor, a small protein-rich breakfast within 30 minutes of waking, her medication taken at the exact same time every day with food, a 10-minute gentle walk after dinner, a magnesium glycinate supplement taken at night, a mineral shown in multiple studies to support vascular relaxation and reduce pressure variability. Within 6 weeks, her readings had narrowed dramatically. She was no longer swinging between extremes. Her average reading was 136/80. Not perfect by a textbook standard, but her energy came back. Her clarity improved. She stopped needing those afternoon collapses. And at her next ophthalmology appointment, her eye doctor noted that the small retinal vessel changes he had been monitoring for 2 years had not progressed. Dorothy told me, "Doctor, I feel like someone turned the lights back on. Not brighter, just steady, finally steady." That steadiness was the goal, and it is achievable for you too. Now, let me give you an exact action plan you can begin tomorrow morning. Start your morning with 16 ounces of water before anything else. Before coffee, before breakfast, before medication. This rehydrates your overnight fluid loss and helps stabilize morning pressure spikes, which are the most dangerous of the day. Take your blood pressure medication, if prescribed, at the same time every day. Every variation of even 1 to 2 hours has been shown to increase variability. Set a phone alarm if needed. Consistency is everything. Eat breakfast within 45 minutes of waking. Skipping breakfast triggers a cortisol response that can elevate and destabilize pressure. Focus on protein and healthy fat. Eggs, Greek yogurt, nuts. Avoid high-sugar breakfasts that cause insulin spikes, which in turn drive vascular instability. Invest in a home blood pressure monitor. They cost between $25 and $50 at most pharmacies. Take readings at the same time each morning after 5 minutes of quiet sitting, before coffee, and log them. Bring that log to every doctor appointment. Advocate for your own data. If your doctor is recommending a medication change based on a single office reading, ask this question directly. Can we do ambulatory monitoring or review my home log before making that decision? You are entitled to ask, and any doctor worth their training will respect the question. Consider magnesium glycinate in the evening. Studies published in Nutrients Journal and the Journal of Clinical Nutrition found that magnesium supplementation of 300 to 400 milligrams daily reduced systolic pressure by an average of 5 to 7 points and meaningfully improved pressure variability in adults over 60. Magnesium is involved in over 300 biochemical reactions in the body, including the regulation of vascular muscle tone. Most seniors are mildly deficient. It is inexpensive, widely available, and generally very well tolerated. Do not make these critical errors. First, do not check your blood pressure immediately after activity, caffeine, or stress, and treat that number as your true reading. Always rest quietly for 5 minutes first. Second, do not stop or reduce medications on your own based on what you learned today. Any changes to your medication regimen must be made with your doctor. What I am giving you is the information and the questions. Your physician needs to be part of the decisions. Third, do not assume a higher number always means danger. Context matters. Age matters. Your overall clinical picture matters. A number without context is just a number. Within 3 days of starting consistent morning hydration, you will likely notice less dizziness when standing. Within 1 week of consistent medication timing, your home readings will probably begin to narrow in their range. Within 2 to 3 weeks, if you have added the magnesium protocol, many people notice improved sleep quality and less morning tension. Within a month, you will have a home log with real data that gives you and your doctor a far more honest picture of your cardiovascular health than any single office reading ever could. So let us bring this all together. We have walked through 7 blood pressure truths that most seniors never hear. We talked about why the diastolic number matters less after 65 than doctors once believed. We discussed the natural daily rhythm of blood pressure and how clinic timing can completely distort your readings. We addressed the salt myth and what the science actually shows about moderate sodium in older adults. We explored white coat syndrome and how dramatically it is inflating treatment rates in seniors across the country. We looked at dehydration as a hidden driver of pressure instability that almost no one addresses. We confronted the 120/80 myth and the very real dangers of chasing that number in a 70 or 80-year-old body. And we arrived at the most important truth of all. That stability, not a perfect number, is what actually protects your brain, your heart, and your independence. My message today is not fear. It is not telling you to distrust your doctor or stop your medications. My message is empowerment. You now have information that most people in your age group have never been given. You know what questions to ask. You know what data to bring. You know what mechanisms are at work inside your body. Here is my challenge to you. For the next 30 days, commit to one thing. Take your blood pressure at home every morning at the same time. Log every reading. At the end of 30 days, you will have a picture of your cardiovascular health that is more accurate, more honest, and more useful than anything a quarterly office visit can provide. And if those readings differ significantly from what your doctor has been seeing, that conversation is worth having. If this video helped you, smash that like button. Subscribe for more real, honest health content designed specifically for adults over 60. And share this with someone who is afraid of their blood pressure reading. You might be the person who helps them stop living in fear. And now I want to hear from you. Which of these 7 truths surprised you most? Was it the variability research? The salt myth? The white coat syndrome rates? Share your answer in the comments below. I genuinely want to know your story because remember, your blood pressure reading does not define your health, and a number on a screen is not your destiny. Your body has remarkable resilience. Give it the right information, the right habits, and the right care, and it will show you exactly what it is still capable of. Take care of yourself.